everyone. We are so happy you're joining us Tuesday morning, 10 a.m., bright and early. We are happy you are here and eager to learn. Firstly, want to thank the Sunny Isles Beach team for partnering with us on a very important discussion right now. But before we start and get into the nitty-gritty of the details, I just want to introduce Dr. Carrasquillo and myself. We're from the All of Us Research Program. So the All of Us Research Program is from the National Institutes of Health, NIH, and is a national effort to help build one of the most diverse health databases in history. Researchers will use this data to learn how biology, lifestyle, and environment affect health. So we can say it is safe to say now more than ever during a pandemic, research provides hope. So without research, we wouldn't have a vaccine or truly any of the cures we have today. So research allows us to fill in those missing puzzles, and research gives us ultimately answers. So how does this Facebook Live relate to the All of Us Research Program? Firstly, All of Us Research supports COVID-19 in several ways. One way is through antibody testing when participants give their blood samples. Also, we have surveys asking about mental health and how the pandemic is affecting you and your community. How you respond actually determines how you respond during a pandemic is determined by your background, what makes you unique from other people, and truly the community you live in. So these results will help researchers learn about where, why, when, all the questions we have about COVID-19 and how it arrived in the USA. And how it affects different communities. I think that's very important to stress. So if you haven't already, we invite you to join the All of Us Research Program as a participant. The health information you share will help researchers learn more about a disease that's affecting us all. So please feel free to put any questions you have about the vaccines or COVID, any questions you have, and we'll get to them most likely at the end, and we'll make sure to answer all of them. All right, so we'll get more about the benefits of all of us near the end. Okay, so thank you, Dr. Carrasquillo, for joining me as well. He is a principal investigator for the All of Us Research Program. So with that introduction, let's get started. So the first question I think everybody has on their mind, vaccines have been rolled out. We aren't in lockdown currently. What is the update on the COVID-19 situation in Miami-Dade?
Thank you. Thank you. And it's always a pleasure to be back with you guys. And again, thank you to Sunny Isles for doing this. This is really great and wonderful. I wish every municipality had this kind of program. So this is really wonderful. But the opportunity to inform people. As Christina mentioned, I'm not only involved with All of Us, but obviously as a clinician, very involved, getting a lot of emails from my patients around COVID. We also work in the hospital, worked in the COVID units in the hospital, but also leading a couple of projects around COVID. We were one of the investigators for one of the vaccine trials, the so-called Johnson & Johnson vaccine, which we'll talk about in a second. But also doing a lot of work about addressing COVID misinformation and miscommunication. So all these are very important efforts that we have in addition to the All of Us project. You know, we're very committed to doing things that are timely and important, and so doing work around COVID. It's clearly been a main priority this last several months. But for COVID, yeah, the updates, we have, I guess, some good news. You know, we still have some issues, which I'll talk in a second. But the good news, obviously, is that now we have the vaccines. We have 2 vaccines that have been rolled out over December, but Pfizer, Moderna. And now we got really good news last week that it looks like the Johnson & Johnson vaccine is also very, very good at preventing severe COVID and seems to have some effect against these new mutant strains. So it's really good that soon we're gonna have a 3rd vaccine on market. So that's really, really great. Nationally, you know, over 30 million people in Florida also, you know, a couple of million people have been vaccinated. So that's really good that we're doing vaccine efforts. The other good news is that a few weeks ago, we were what we call the holiday surge, right? We had a lot of cases of COVID. It was really scary. And now finally, in the last 1 to 2 weeks, we've seen all these cases really come down. So it's really good that we're getting over, you know, what we are calling the holiday hump. Some people calling it the 3rd peak, whatever you want to call it. We're getting over it. So the COVID numbers are coming down. But we do have a little bit of bad news. One is obviously we're hearing about these variants that seem to spread much better than others, and some that may be a little bit more resistant than others. So that's really worrisome. The other thing is that the vaccine rollout has by no means been perfect. It's been problematic. And we've had lots of stories about people really desperate to try to get the vaccines. And this is not just the state of Florida. It's been problematic nationwide. The good news is that now we have new federal leadership that are more committed to doing a much more robust distribution effort. And I've seen some efforts from the state government. They've actually gotten their act together. Now there's a centralized website where you could sign up and phone numbers. So, overall, it's a good news. The numbers are down. The vaccines are coming online, but it's still going to take us several months. We're by no means out of the woods yet. We still need a lot of patience. It's going to take us a while to get everyone vaccinated and to have adequate supply to vaccinate everybody. So overall, it's a mixed bag of good news and a little bit of we're still working on it news.
Very good. Dr. Carrasquillo, it's good to see you this morning. Just to introduce myself to everyone else, I'm Sylvia Flores with the City of Sunny Isles Beach. And I just wanted to join the conversation, had a few questions, Before we get more into the vaccines, I wanted to backtrack a little bit and ask a few questions just for the public about the virus itself. So can you tell us what it means to be asymptomatic?
Yeah, so one of the things that's up, I get a lot of calls from somebody saying, this person in my house had the virus and I got myself tested, but I don't have any symptoms. How can that be? People need to understand about 80% of the people who have COVID even have mild and no symptoms, which is what really scares us, right? Because these are the people that are out there, if you're not wearing masks and doing the proper social isolation, you are spreading the virus around, even though you have no symptoms. So about 80% of the people, so it's not unusual at all, especially young people, healthy people to have no symptoms. It does happen. About 15% of the people get, symptoms that are pretty bad, cold-like symptoms, fevers, body aches, and all the usual loss of taste, loss of smell, diarrhea, a lot of the, many typical symptoms that are associated. And only about 5% end up in the hospital really ill, and an even smaller number end up on ventilators. And we know about 1 to 2% of the people that get COVID end up dying, which is really sad. And we know that those highest risk are the elderly, people with multiple medical conditions, severe obesity. So we do have a lot of the risk factors we know for that. But in general, 80% of the people with COVID don't have symptoms, and those are the ones that could spread it, and that worries us.
Do we know if those who have symptoms and those who are asymptomatic, are they just as contagious, whether they have symptoms or not?
I don't know if they're just as contagious or not. I mean, if you don't have symptoms, you're not coughing, you're not, on people and things like that, but you're still contagious. I mean, by all means, you're still contagious, and you could definitely spread it. And so that's why, even breathing out normally, you can spread it if you're in an indoor space, indoor location. And that's why it's up to everybody. You wear the mask, as I tell people. It's not just about you. A lot of people refuse to wear masks because I'm healthy, nothing's going to happen to me, which is not true. I've certainly admitted tons of young, healthy people to the hospital, really not being able to breathe, and we've had to put them on oxygen or even breathing machines. But it's the people that say, I don't want to wear, I know if it's for me, I don't want to wear a mask, but it's also about other people. It's about preventing our grandparents, preventing our relatives who are sick, or it's preventing anyone out in the community be sick. So not wearing a mask is basically not trying to help society overcome this, because not just you, it's your risk of spreading it to others.
Definitely. And can coronavirus live on objects?
Yeah, so back, early on, there was a lot of stuff about what's the main way to transmit it. Now we know a lot of it is respiratory. Nevertheless, it can stay in objects. We know it does. And still washing the hands and frequent alcohol sanitizing is still important. Most important is the respiratory issues, the social isolation, maintaining the 6 feet, wearing the mask. But clearly, frequent hand washing or alcohol on your hands is also important.
Awesome. So hi, Dr. Carrasquillo. This is Nick.
Hi.
Again, nice to see you again. Happy to be here. And I wanted to jump in and ask some questions for you. So what are the main differences between the common flu and COVID?
Yeah, at this point, there's a lot of effort early on. At this point, what I tell anyone who calls me with almost any symptom is go ahead and get yourself self-tested. COVID is so like any other virus. It presents in many, many different ways. I mean, the gastrointestinal symptoms were something early on that, hey, that's not a typical flu-like symptom. And then we also saw a lot of the stuff, loss of smell, loss of taste, a lot of these other symptoms. But with COVID, you just don't know. Anything can be. So if somebody calls me with high fever, muscle aches, I can't tell if it's the flu or not. Please get yourself tested because there's really no way to tell whether it's COVID or the flu unless you do the test. When people come to we have a special clinic to see patients with COVID when they don't need the emergency room. And we do a whole panel. We test for COVID, we test for flu, and we test for a bunch of other viruses because you really don't know which one it is.
Okay.
By the way, a lot of the stuff we do to prevent COVID is actually extremely good to prevent the flu from spreading too. So,
very good. One of the things that has, well, there's a lot of things that have, grown or revised over the time that this pandemic has been going on. One of the questions we had was about exposure time. So how long after you know that you've possibly been exposed to someone who is positive, should you wait to realistically test before having a true result about whether or not you've contracted it as well?
Yeah, so here for our employees, our guidance, obviously, if you were next to somebody, this morning and you get tested 3 hours later, you're going to be negative, right? It takes a while for the virus to grow. So here we're advising we wait 4 days before testing them after exposure. And people get a little bit upset. They're like, no, I want to be tested right now. You're like, well, it takes a while for us to know whether, you got the virus and whether it's replicating inside or not. So yeah, it's a bit upsetting, but that's what we tell employees. They have to wait 4 days. And in those 4 days, you can get the virus and spread it to other people. So you do need to stay away from other people and everything else because you're potentially, infectious at that point. And we just don't know. We just don't want to test somebody the day after, like people want to be tested and then say, oh, you're negative. And they're like, oh, I don't have the virus. That's great. It doesn't work that way.
Right.
So people get a little bit upset that they have to wait a few days before being tested, but that's just the way it has to be.
Dr. Carrasquillo, there's a question from the Facebook Live here that I just think kind of corresponds directly with the conversation here. What benefit is there to wearing a mask on the beach if I'm socially distanced and outside?
Yeah, so a lot of people are like, hey, so if you could think about it, right? If you're at home with no one else, obviously you don't need to wear a mask. So people want to do that outdoors, right? Like what's the safe limit where you don't have to wear? And we just don't know, right? Depends wind conditions, a lot of other things, right? Does it make sense if you're by yourself and there's nobody around you for 30 feet to wear a mask? Probably not, but you don't know who's going to come running by you, who's going to be behind you, and you don't know. So if you really want to be socially conscious, you would wear a mask. But clearly, if you have a very, very wide radius around you, probably the benefit of spreading it, not that much, but you just don't know.
Okay. So switching gears for a second, how does the COVID-19 disproportionately affect communities of color?
Yeah, so, it's one of the things that became evident, and now we're seeing the opposite, which is really sad in the vaccines. We'll talk later. But, early on, it was clear that obviously, the most vulnerable in our society were hit the hardest. And by vulnerable, I not only mean the elderly and people with a lot of illnesses, but also minorities were being hit harder. And that was, due to a lot of different reasons. First of all, minorities do suffer disproportionately from some of these health conditions. But more importantly, minorities are more likely to be essential workers, for example. So the jobs that you can't do from home, that you have to take the train every morning. We know transportation was a source of spread early on. Also, they live in more crowded housing conditions. They're more likely to live in bigger households and in more communities, more higher density of people per household density. So there's a lot of reasons why minorities, for those that don't have health insurance, since minorities are more likely, they're more likely to wait. They don't have a primary care doctor like some of my patients. They can just send me an email, hey, I have this, what should I do? They're less likely. They're also more likely for things, other reasons, to fear their healthcare system and not want to come in. So we saw a lot of Hispanic farm workers coming in really with extremely scary oxygen saturations because they really waited to really advance. So it's a lot of different causes, but at the end of the day, we in medicine, we call this the social determinants of health because we know a lot of health comes from a lot of these other factors that are socially related but affect your health.
Okay.
Dr. Carrasquillo, so moving into more specific questions about the vaccine itself, given how quickly it came out, there was a lot of talk that it would take years for something to come out, and then, lo and behold, December, things start rolling out. How safe is the vaccine? What do we know about the different options that are out there, Pfizer and Moderna?
Yep, that's the number one question I get. How was it done quickly? I do believe there was some misconception about how quickly the vaccine was rolled out. I mean, we know the Moderna RNA vaccine, for example. Moderna was a new company, but the technology was being worked on in the National Institute of Health for the last several years. I was at a conference with Dr. Corbett. She's an African-American physician, scientist, one of the leaders, explaining how she's been working for the last several years. This has been her life, trying to develop these type of vaccines. So we know the vaccine development. We already know that messenger RNA vaccines were tested in certain patient conditions and other things. So it wasn't like it just came in, these messenger RNA vaccines. But the other thing was the amount of sharing. Usually when companies work on these things, they keep everything to themselves. It's very confidential. They all want to make money on this. COVID was different. Everyone shared right away. The whole genome sequence of the virus was immediately shared. People started, every time they had data, they would share with each other, everything else. And the other way was how we did the vaccine trials. I mean, I've never done research like this. Usually it takes me several months to plan a study. Christina may know it took us several months to start all of our study planning. This was from 1 week to another. I had to put everything on hold. I didn't hire new staff. I took my existing staff, told them, stop everything else. This is what you're working on. We did an incredible pace, a lot of stuff. The websites, those early days kept crashing. We had to re-upload all the data. I mean, it was a lot of stuff and doing it up, and we really did it. It was a 24/7 operation for those several months to test the vaccines in a way we've never done research before. So it was unprecedented. I mean, it was Operation Warp Speed, and everyone worked like if we're in the middle of a terrible pandemic that we need a solution for right now, which is what it was. And that's why we had to work, and we all got our act. A lot of sharing among scientists, all the data right away. So it was heroic. We do have, and so people ask me, am I a guinea pig? Am I the first person for the vaccine? Well, we've already seen, over 30 million people have been vaccinated, but people were starting to be vaccinated back in August for the vaccine trials. They got approved in December, but the trial started in August. So we have several months worth of data on side effects and safety. And from what we know, we do know that at least for the messenger RNA vaccines, for example, what we do know is that, they do have side effects. 80% of the people get pain in their arm. It lasts 1 to 3 days. A lot of the people get fatigue. A lot of the people get muscle pains, and some people get fever. Again, these symptoms last 1 to 3 days. So we know that there are some effects in the vaccine, and we'd be lying if we said we didn't. But long-term, we follow a lot of these people. In terms of long-term side effects, at least over several months, we haven't seen no signals that people complain about. What was really interesting, I don't know how well people read the Janssen vaccine. In the Janssen vaccine study, the side effects were greater in the people who got the placebo than in those who got the vaccine. So it was interesting. My wife was one of those people who was in the Janssen vaccine study. And after she got her shot, she knew she got the vaccine. She had fever, she had muscle pain, she felt bad. And then when we ended up unblinding her, turns out she got the placebo. She did not get the vaccine. So
oh, you must have been shaking your head like, oh my God.
Yeah, the other story is my boss, who a week after the vaccine started getting a lot of pain in his arm. And he was like, that vaccine, look what it did to me. And then the secretary reminded him it was in his other arm. So
a lot of it,
he got the shot.
Like,
so, those are the things.
Yeah, I feel like a lot of it we can, mentally just.
But there are side effects, especially with the messenger RNA. There are side effects. They last a few days, but it is important. People that we're honest with people that the arm may hurt for a couple of days after the shot.
Is the COVID the virus strain in the vaccine itself?
Yeah, so people ask me a lot about that. And what we inject, there's different ways to deliver genetic material. And that's what we do. So there's no live or dead virus. There's no virus. If you've all seen the picture of the COVID virus, there's that little red spike, what we call the spike on it. That's why it's called the corona, because of all these spikes. That spike is the one that probably creates the best antibodies to defeat the virus, when the body creates antibodies against that spike. So all the vaccines, basically, they get into you the information to create that spike, so your body can create antibodies just against that spike. It's not against the whole virus, which was what causes the problem. It's just that little bit of surface protein. And that's where our bodies are creating the antibodies. So there's no live or dead virus. There's no way being injected with COVID. It's just the information to create that little tiny piece that the body seems to be really good at making antibodies against.
Is there sorry, Nick, I'm hogging the line for a minute. Is there a difference between the different vaccines, Pfizer, Moderna, and you mentioned the Johnson & Johnson that may be coming online soon? And if you had a choice, the ability to choose, what would you look at to choose which one you would want to take?
Yeah. And what I tell everybody is the best vaccine for you is the vaccine you're offered. We could work about other issues later on. Right now, it's not like a supermarket where when you sit there, they tell you, these are the 3 vaccines, which are the ones you want, and you pick it. It's the one that they have. We know they're all effective. We know they're all pretty safe. So at this point, I'm telling everybody, please get the vaccine that's offered to you. The first one you have a chance to get, that's the one you should absolutely get. Don't worry, we know they all work. We need everybody vaccinated by June. The longer we wait, the longer people delay on this, we're not going to go back to stop wearing masks. Nobody wants to be wearing masks. Nobody wants to do social isolation. We hate all this. We need everyone vaccinated so we can end this episode. And the only way we're going to do that is we get the vaccine. There are slight differences. The Pfizer, Moderna, both messenger RNA, so it's messenger RNA code. The Janssen vaccine uses, and it's delivered through like a fat droplet, a lipid capsule. And it's very amazing technology, but that's how it's done. In the Janssen vaccine, it's an actual, virus, which is harmless, which delivers it, an adenovirus. And that's how it's delivered. But either of the 3, we know they're effective. We have good safety information on them. Please get them. Somebody, we know that it looks like Pfizer, Moderna. We don't know yet because they were done at different times. Maybe better at preventing you from getting any COVID. They're both effective against severe COVID and preventing in the hospital. And some people are saying, well, maybe I should wait till I can get the Pfizer, Moderna. I say, look, get a shot now. We'll figure it out later down the line if you want to get another shot or something else with another vaccine. But right now, what's really important is that you get whatever's offered to you right now. And right now, all we do have are the messenger RNA vaccines. The Janssen is not going to be approved probably till the end of next month if we're lucky. At the end of this month if we're lucky. Forget we're in February.
And will the vaccine protect against the new strains, the new variants that are coming out?
Yeah, so, it's one of these things. We know Pfizer, Moderna are getting ready to do, if they have to alter their vaccines to be up against these new strains. The Janssen vaccine was actually tested when the strains were there. One of the countries is South Africa. 95% of the people in South Africa had that strain. And we know the vaccine was effective. It was about 50% effective against the South African strain, but it was also really, really effective against preventing almost everybody who got in South Africa, preventing them from being in the hospital. So it really was really good against preventing severe COVID against that South African strain variant. So we do know that it has some effect against these variants. So we know that the other vaccine manufacturers, if it turns out that there is resistance, are very quickly able to pivot their vaccines to meet this. So it's hopeful data, but the most important thing we have to do right now, again, is get vaccinated before these new strains take hold in the country. That's the real strategy. Prevent them from, being able to be spread by getting vaccinated right now.
So there, with the different vaccines that are out right now that you were discussing, are there different dosing requirements? I've discussed with people that are waiting for the Johnson & Johnson vaccine because it's only 1 dose. Can you discuss?
Yeah, correct. Yeah. So, the Johnson & Johnson vaccine is only 1 shot, although now they're doing a study to see whether 2 shots are better than 1. We don't know, that study's just starting. But yeah, some people, I just want to wait for that one. And I say, no, let's not wait. If you're offered it, first of all, most people are not being offered the vaccine, right? Let's get realistic here. Right now, it's healthcare workers, the elderly, and institutionalized people, right? So for most people, it's not an option to get it. But what I say is, get the one you're offered right now, because that's what's important. But yeah, the Moderna vaccine, you got to come back at 28 months for a second shot. With the Pfizer, you got to come back in 3 weeks for your second shot. Whenever, and again, the Janssen vaccine is not even approved yet. There's no need to wait several months for that to happen. And after it's approved, it's got to be distributed. It's got to be this, so we're looking maybe at least a 2-month lag. So if you're offered the vaccine now, please get it. This whole thing, I want to wait to only get 1 shot instead of 2. We need everyone protected right now. That's the most important thing.
Just a follow up to that. Do you have any information on the timetable of when the larger rollout would occur for people?
So all the manufacturers are working extremely hard to get enough doses in the supply. I've seen some very aggressive numbers. I can't tell you. if the Janssen vaccine, I mean, I was just sitting at a meeting, the Johnson & Johnson, I call it Janssen, the Johnson & Johnson vaccine, they have several million doses and they anticipate by June having 100 million doses. I've seen numbers like that from the other manufacturers as well. I'm fairly certain by June we'll have enough vaccine doses for the whole country. It'll be how we distribute and roll them out. That's probably going to be an equal logistical issue. I can't give you a timetable, whether it's June or September when we'll be out of this, which is what everyone wants to know. I'm hoping by the fall, we'll all be vaccinated and happy. But the other half is making sure people do get the vaccine, which is my other major concern, because we see a lot of data that people don't want to get the vaccine. And if people don't get the vaccine, you know what? The mask and the social isolation is going to be here for a long time, and that's not what we want.
If you already had COVID-19 and are recovered, do you still need to get the vaccine? Sorry.
Another extremely common question. We do know COVID antibodies do confer some level of protection. We don't know how much, and we don't know how long it lasts. And we know people that have had COVID that have gotten it again. So the recommendation is that if you have COVID, get vaccinated. We advise people to wait 90 days. The antibodies seem to be protective for at least a few months, but then they should get vaccinated again. So if you have COVID, you should be vaccinated, but wait 90 days, 3 months.
And so would that hold true for the vaccine itself? Or so would the idea be that you would continuously need to retake the vaccine?
Yeah, so for the vaccine, we've been following people for months. And what's amazing is the antibody seems to stay pretty positive for at least several months. The other day I was looking at some data from the Janssen vaccine. It was amazing, several months, and the people stayed with antibodies. We're following the people long-term in these studies for many years. And Janssen is going to be at least 2 years that people are going to be followed. And we have pretty good data that the antibodies stay, but I can't tell you whether you're going to need a shot next year or not, which is what everyone wants to know. I'm like, get your shot today, and then we'll talk next year about whether you need another one or not. It's not, people want to know what's going to happen tomorrow. And I'm like, let's deal with today first. So we don't know. We have good data that at least, they stay positive for several months. And next year we'll know whether we need another shot or not. We just don't have that answer right now.
Okay. So here in Florida, obviously tourism is a staple. Have you heard any reports about people coming to Florida to receive the vaccine because they're not getting them in their areas, or?
Yeah, in the media. So one in the media, obviously, our governor was very upset to hear that. So last week or 2 weeks ago, he issued an executive order. The vaccine is only for residents. And he put a whole bunch of criteria there. Either you have a driver's license, you have to have proof like a utility bill or something to prove that you live here, because he is very upset about these reports. I've certainly heard about snowbirds who are coming down to Florida because they think it's easier to get it here than in their own states. And then they come and realize, hey, things are equally problematic here as wherever they were up in terms of getting the vaccine. And so the governor really wants Florida residents to be vaccinated first. I've gotten phone calls. My parents, they live in this country, but they're here for 3 months. Can you please get them a vaccine? I'm like, look, these are the rules. These are the requirements. This is how it works. So yes, unfortunately, everyone wants a vaccine. We've seen very creative people. More importantly, we're concerned about who's getting the vaccine, right? And that's what bothers me more. We're seeing the same disparities, but in opposite. So we see that minorities are much less likely to get the vaccine than whites. We've also seen, obviously, you've seen the media reports about how the rich and the powerful have somehow found ways to get in front of the line and been able to get vaccinated. We all know Fisher Island turns out to be one of the places, according to Miami Herald, that nearly half the people have gotten the vaccine yet. And, it makes us nod our heads. But we always know that happens, how the rich always find a way to get ahead through whatever channels, mechanisms, or calling their buddies they have. So that bothers me a lot more than these cases about the medical tourism and everything else, but the disparities in the vaccination. And we don't know right now, this whole digital approach, go online. Well, if you don't have internet access, or you don't have high-speed internet access, if you're working all day, it's much harder for you to get online and be waiting and keep, refreshing and try to get that. So that's one component of how the rollout has been. And we need to really make efforts that we're making sure these vaccines are being made available to minority communities. But I'm also very concerned about a lot of the misinformation and miscommunication that's being targeted at minorities to try to convince them not to get the vaccine. And that part really scares me.
Mm-hmm. There's a few questions coming in through the Facebook Live.
Oh.
So one of them is it true Johnson & Johnson's baby powder caused cancer? If it is, how do you know the Johnson vaccine is good?
Somebody actually much, so I don't know much. The answer is I don't know anything about the whole Johnson & Johnson baby powder, but somebody asked, how can I trust a company that creates cancer? And I was like, so the answer is I don't know, but I can tell you, I mean, I worked in the vaccine trial, the amount of rigor and the amount of stuff that and I have friends who worked at Moderna. I mean, this is very rigorous. When you had any symptoms, right away, we would go to your house or make you come in. We do all these very extensive checks and follow-ups. Whenever you report anything like COVID, we test you right away. We do this. And, the amount of data collection, the amount of record keeping, the amount of redouble checking to make sure everything in our records was correct. I mean, it's been amazing to do this something more at speed. So I can tell you about the integrity of the data and the efforts we've done to collect this. So I could tell you that based on that, we've seen no signals about anything like this or anything bad. And we did a really good job at collecting the data. But I'm not going to comment on cancer and baby powder. It was interesting. I hear it again. I heard it from somebody else. So apparently it's being floated in these websites and these, chat groups. So I should look more into that whole baby powder stuff.
Do you foresee the COVID-19 vaccine becoming much like the flu shot, an annual thing?
Yeah, I think Nick asked. We don't know yet, right? We know that antibodies last a long time, but we'll see. I mean, I can't tell you right now. What I do foresee is that we don't all get our COVID vaccine shots. We're going to be wearing masks next Christmas, and we don't want that. That I can guarantee everybody. So we do need to get our first shots now, and we'll deal with it next year, whether we need another shot or not.
Dr. Carrasquillo, is the vaccine still considered experimental?
Well, it's under what's called it's emergency use authorization, right? Because we don't have all the long-term data and outcomes. We just have data from the first few months about efficacy. So they're still under EUA, which means like we can't make it mandatory for healthcare workers or something like that. So we have very good data over the last few months that they're safe and effective, but they're still under EUA. It's not the full FDA review that would normally happen. And that's the process that takes a long time, right? You need data for a much longer period of time, and it's a much more careful deliberative process. But when you have a pandemic and you have an emergency, you need to release these under emergency use authorization because, I mean, the numbers, almost about 500,000 people have died. We're almost about that threshold. We need to do something now. I mean, to think about 500,000 people dying in the United States, that's amazing, like no other pandemic. I mean, this is, just numbers off the scale.
Yeah.
The leading cause of death for the past year was actually the coronavirus. It exceeded heart disease, which I was like, oh my God. So it is something we have to reckon with.
And we do have a couple of questions coming in on the Facebook regarding people with allergies. I know you mentioned a little bit about the side effects that some people do experience. Quite a few people are asking about people with allergies. What kind of side effects would they experience or autoimmune problems?
So I had the allergies first. So there were some reports early on out of England about severe allergic reactions with some of the vaccines. What we've done here is when we vaccinate people with allergies, we do watch them longer. We make them stay for 30 minutes instead of 15 minutes. We do watch them. If they had a reaction to the first one, we watch them longer the second time and things like that. But we haven't seen that much of an uptick, all these mass reports about allergies and everything. It hasn't seemed to be happening here, but we do watch people a little bit closer after allergies. But certainly if you have allergies, you do need to be vaccinated. And the same thing for autoimmune diseases. I always tell people, always check with your doctor, whether it's a rheumatologist or internal medicine, about whether it's safe. I certainly get a whole bunch of emails from patients, I have this and this, can I get the vaccine? And so far I've told everybody yes. There may be certainly very rare conditions. I know some of the oncologists of people getting active chemotherapy, some of them are saying maybe hold on until you finish the cycle of chemo before you do it, but always check with your doctor. But in general, for nearly almost all people, the answer is yes. Certainly autoimmune diseases makes you at higher risk of getting COVID and higher risk of getting complications. So certainly, you're considered a high priority group to actually get the vaccine.
Very good. There's another question that came in I'm just going to read it. It is disheartening to hear that some of the individuals who are smokers have been prioritized for the vaccine versus elderly or older adults. What do you think about that?
I've seen the governor's guidance, which is right now it's for the elderly healthcare workers. I haven't seen the smokers priority. Maybe it's like that in other states. I'm not sure. Certainly you don't want to discriminate against people. You don't want to put people on the bottom of the list because they smoke or something like that. But I've not heard the story, so I can't comment on that about smokers being prioritized over the elderly. That would be inconsistent with the governor's recommendation and orders for how the vaccine will be distributed. But certainly if you're elderly and you smoke, yes, you should get the vaccine, just like any other elderly person. We're not going to tell somebody you're elderly, but you smoke, so don't get the vaccine.
Mm-hmm. We also have, Christine, if you don't mind, I'm going to go in. We have some questions that we received from the public prior to the event. So we have a lot of questions. I don't know if we're going to be able to get to all of them. We're going to try to get to as many as we can. There's quite a few in here that have a similar undertone. So a lot of it is access. So, I'm elderly, my husband's elderly, we're high risk, various things. How soon can we get the vaccine? Do you have any info about what the rollout is going to continue to look like?
Yeah, and again, it's problematic. The main issue is that the supply has been limited. But the thing that has amazed me is we've known the vaccines were coming out for months, and there was no plan to distribute the vaccines. I mean, it just shocked me both at the federal level that there was no plan for vaccine distribution, and at the state level, the plan was let's give it to the hospitals and let the hospitals figure it out. I mean, we have a major pandemic, health systems do not have experience in mass vaccination campaigns. That's usually done coordinated at the government level by either state or federal government. And so that's been absolutely shocking. And it breaks my heart how really problematic the rollout was. Most health systems have tried to do their best with the limited supply they've received. Here at our health system, we prioritized, first the elderly with multiple comorbidities. And we did have those who are our patients got emails inviting them to get the vaccines. And then we've moved it now for most elderly who are age 65 and over, but our supplies are limited. Last week, we had to stop new vaccinations because we don't have enough supplies of the vaccine, for example. So it really depends on the availability. We try different ways of how to do it and different distribution. Now we set up a big organized distribution site that's a couple of blocks away from my office, but it's a very good space. They have bathrooms, they have everything. They're really well set up. But, it shouldn't be each health system trying to figure it out. Jackson, our sister health system, they did not prioritize people with multiple comorbidities. They opened it up for everyone 65 and over. And within 30 minutes, the websites, got filled right away with people. This should have been a much more coordinated response at the state and federal level. Fortunately, the Florida Department of Health now has a website where you could sign up for the vaccine and they'll call you once they have a dose ready for you. More importantly, they've set up a phone number. So if you don't have internet access, each county has a dedicated phone number. I'm sure you guys can provide those on your website, but it's critically important. We are making progress. I've seen some really good signals from the new federal administration. They're going to take this seriously. And really the type of distribution plans that are common sense that should have been done 4 months ago.
Another question is regarding some elderly who are waiting to get vaccinated, but there's actually a few in here who've expressed that, they started experiencing symptoms and now they got tested and they're waiting for those test results. So if those test results come back positive, asking, do they still need to be vaccinated?
And again, I think wait 3 months. Yeah, wait 3 months up. I know people are very upset. The best anecdote I have about people waiting and then, what happens, it's my mother. She actually lives in New York and she finally got, it was her turn. And then turns out, guess what happened yesterday in New York? They had a blizzard. So she missed her turn. And now she's like, when can I get it again? And stuff like that. But yeah, these things will happen. If you do get COVID while waiting for the vaccine, unfortunately, you should wait. And if you're waiting for test results and you're ill, do not, get the vaccine. I mean, that's the one shot. Some people call me sometimes and say, I'm really, really sick. Should I get the vaccine? I'm like, no, maybe wait a week or so till you're better. I certainly don't advise anyone who's really ill to get any vaccines when they're ill.
Okay, and someone else asked, after a person gets the second dose of the vaccine, when is he or she able to return to quote unquote normal life?
Well, yeah, so that's what I always, what they mean by normal life, because a lot of people, they get the shot and they think they could go out and party that afternoon. And I'm like, no, it doesn't work that way. Um, Antibodies start developing typically about 2 weeks after it, and it's only after the second shot that you have the most protection. But remember, a lot of people have not been vaccinated first, so that normal life, you still got to wear a mask, you still got to do social distancing because there's a small probability you could still get it and still pass it. The mild asymptomatic form, you can still pass it. It's a small chance, but it can still happen. So what they mean by normal life, if normal life means taking off your mask and not doing social distancing, that's not going to happen until everyone gets vaccinated. But certainly you do start your maximal protections. After 14 days, you start being protected. And after a month, you probably have the maximal protection benefit. So.
Okay. Another question. My wife has rheumatoid arthritis and is very concerned, actually totally reluctant to get the COVID vaccine. Can you address the vaccine studies as it correlates to existing immune disorders?
Yeah, so I mean, they enrolled up. I know the Janssen is about 40% with specific comorbidities, but the number of people probably with autoimmune in these studies are very small. What I do tell everyone is please check with your internist rheumatologist. For my patients, what I'm telling them, they have rheumatoid arthritis and all these other autoimmune conditions and medications is if you've been on a stable dose and you're doing well, definitely get vaccinated because you're the person who's going to get really sick if you catch COVID. So I'm strongly encouraging them to be vaccinated. But of course, if they're having a bad rheumatoid arthritis flare, if their joints are really, really, inflamed, they hit one of these weeks that it's really, really bad, certainly say, maybe for you, maybe you want to wait until this flare passes. Certainly if your rheumatologist is putting you on high dose steroids because you're having a really bad flare, again, that's not the time to get vaccinated when you're acutely ill from something else and on very high dose steroids. So again, we don't have good data on that. So this is where we're working on common sense. And common sense says if you're really sick, wait a little bit before you get the vaccine. But if you're on a stable dose and you're exactly how you've been doing for the last 3 months, definitely get the vaccine because if you get COVID, it's going to be a lot worse.
Okay, very good. Christina, do we have any, I'm weeding out a few of these last questions. Do we have any more on Facebook Live?
Yep, we have plenty. Let me just see here. How long does the immunity last?
Same question. Yeah, everyone wants to know how long I'm protected for. And I can tell you, you're protected for several months at least. And the data looks really, really promising that you're going to be protected for a lot longer than that. But since we started vaccinating people in August, that's the data we have. But it looks like you'll be protected for a long time. I can't tell you how long time it is. Next year, I'll tell you whether long time means a year or longer.
Mm-hmm.
Does it vary between people?
Yeah, so we've seen, I've seen, so they're doing all those subgroup analyses in immunogenicity. I've seen some of the data among elderly. It's slightly less against elders, but even they seem to maintain really good antibody levels. So it's not, it looks like across most groups, you do have pretty decent long-term antibody protection. But again, in the Johnson & Johnson study, I mean, there's a whole subset that it's all about immune levels and looking at all these immune markers long-term. So, it is the data that we need to collect up and we are collecting it.
Okay, here's a good one. They're all good. Let me rephrase that. All these questions are amazing, but here's a good one to ask that people would want to wonder. There are people who can't take any medications or vaccines. My grandma is one. Taking the vaccine for her can be fatal, so it is fair for people to be worried. Every medication has side effects, so people are very worried. So I guess more so of a comment, but do you have any remarks on that?
Yeah, many of my patients, my mom, they take a lot of medicines and they're worried. And so I get a whole bunch of those emails. Certainly reach out to your doctor and ask your doctor and what they think. Again, these people with a lot of illnesses, I say, yes, you're the first one to get the vaccine. Please get it. I know it is concerning. I know people have it, but these are the people that are super high risk COVID. I mean, again, not everyone works in the hospital. Not everyone has firsthand experience when these people get COVID, how sick they can become and how really devastating an illness it is. I mean, people know people can die from it, but it's very different when you work in a hospital ward and you're seeing these patients really, really ill. It's really eye-opening to many people. And so they're definitely the high priority group. And again, if you're not ill, if you're unstable, I tell all my patients definitely get the vaccine. I understand it's a concern. I have diabetes, I have high blood pressure, I have sleep apnea. Every chronic medical condition I've had questions about, and every single person I've said, yes, definitely get it. But yeah, if somebody's calling me that they have a chronic obstructive lung disease and they have a high fever, they're coughing, they're wheezing, they're this, they're that. Okay, let's get you over the acute illness. Let's make sure you don't have COVID. Let's get you over the acute illness, and then we'll deal with the vaccination.
Mm-hmm. Another one is, can someone refuse to take the vaccine, or will they be forced to take it?
I mean, so it's an emergency use authorization. It's come up mostly for the healthcare workers. Obviously, we're a special group because there's a risk we could pass it on to patients. That's why we are mandated to have flu shots, because we don't want to give it to our patients. Right now, it's an emergency use authorization, so there's no mandatory. A few years down the line, if COVID is still here, and hopefully it won't, and can I see people making it mandatory for healthcare workers? Maybe, but right now it's not mandatory. And as you know, there's no mandatory about shots for the general population. Many of my patients don't want to take a flu shot. It breaks my heart because many of them are at high risk, but I can't force them to do it. There's no mandate to do it. So, it'll be strongly recommended, but, there's no law that says you have to get a flu shot.
Okay. I believe that's all for Facebook. Did you have any others?
I do have a couple more. Sorry, Dr. Carrasquillo. One of the questions is, do you know if any of any animal studies being done with the vaccines?
Animal studies? Sorry, a lot of animal studies have been done with the vaccine. I'm sure they're testing all kinds of things with the vaccines on different versions, different forms with animals. But I don't do animal research, so the answer is no. The group that I know they're actively testing that's really important is actually children, because we don't know these vaccines in children. And I know several of the manufacturers are doing studies on kids, and they promised us by June they'll have that data available so that then we could vaccinate the kids. We all want the kids to go to school, trust me. Mm-hmm. Everyone wants them out of the house. Everyone wants them in school. We also know that's a much better learning environment for many kids. So there's many, many excellent reasons why we need kids back in school as soon as possible. I'm hoping they'll go back to school before all the vaccines are done. The vaccine children studies are done, but we certainly know that's an important group to get data and get them vaccinated as well.
Another question is regarding the vaccine itself. How safe are you after the first dose?
Yeah. And so we know the first dose gives you about 50% protection. With the second one, you get to 90% protection. So the first dose does give you some protection, but you only get the maximal benefit after 2 doses.
Okay. Very good. And go ahead, Christina, sorry.
No, go ahead. You go ahead.
No, I was going to cover that question that came up. So someone online is asking, or says, there are more studies being conducted. Would you suggest volunteering for any of the studies?
Oh, absolutely. So what I tell people is everyone who wants a vaccine and can't get it, hey, there may be some study you may qualify for. It was the same reason I got my family to participate in the vaccine studies early on. They had a 50% chance of getting the vaccine. It was the only way you could be vaccinated early. But more importantly, you're contributing to a lot of the research and a lot of the medical knowledge. So that's really important. What we are doing in these studies, for example, the people that volunteer in our Janssen vaccine study, once it's approved, it's not approved yet. Once it's approved, everyone who got the placebo, we're going to offer them the vaccine. And for the healthcare workers in the study, we're going ahead and unblinding them because it's important they get vaccinated. And if they got the placebo, then we're going ahead and vaccinating them right now. So whenever somebody's offered the vaccine, we will unblind them. We don't think it's ethical to leave these people without a vaccine. So as soon as somebody contacts me who's in the study, hey, I'm going to get the vaccine next week. I need to know where they got the vaccine or the placebo. We will go ahead and let you know so that you can get the vaccine. So certainly volunteer for the studies. It may be one of the easiest ways to get a vaccine early. And if you got the placebo, eventually they'll let you know so that you can get the regular vaccine. But definitely volunteer for the studies. I mean, these are all heroes. The reason we are where we are today was because all the volunteers over the summer and fall, all these people that bravely came forward and wanted to participate, it was their contributions to research why we are where we are right now.
Very good. I think that's all the questions that we had beforehand. Have we covered everything on Facebook now?
I think so.
But it does pivot back to the All of Us study, right? I mean, the importance of participating in research, which has been way before COVID, was something, and making sure everyone participates. We want minorities, we want everyone. We want these studies tested in the whole population for whatever it is that we're studying, and to make sure the findings are generalizable to everybody. For the COVID studies, one of the things I was concerned about was limited minority participation, because then we would have a vaccine that only works on people who are low risk. And I wanted enough high risk people. I wanted enough elderly, enough minorities, enough sick people to vaccinate so that we could make our data generalizable to everybody, which is really good. And the All of Us research program is another really wonderful opportunity to actually inform. It's not an immediate public health crisis, but the information we're going to get, linking your genetic information, linking your medical records, linking your social environment, all that is going to have major impact in health research for the next 20 to 30 years. And we want to make sure everyone's adequately represented in that. So soon we'll be reopening again, right, Christina? Hopefully February.
Yeah.
That's the plan. And hopefully by June, we'll be back to full enrollment. And anyone who wants to participate, it's really a wonderful study. That is basically collecting a lot of baseline data and following people for 10 years to see how their gene, their environment, and everything else, their medications they take, interact on health outcomes. So a really, really powerful study. It's 1 million people that are being recruited across the nation. Here in Miami, we have about 10,000, and we want to recruit 40,000 over the next couple of years. So another wonderful opportunity for heroes to come forward and make important contributions to the future of medicine and our medical knowledge.
Yeah, and not to mention that you also will you'll receive your genetic results back, your DNA results, and some characteristics on traits and your ancestry. So there's a lot of beneficial information that you'll also receive, as well as finding out, obviously you have to consent that you want to receive this information, but you'll be able to receive predisposed medical conditions as well, and any medications that you may be prone to, not be able to use or whatnot. So with that, I think we're ready to close. I think we've answered everything. So I want to thank you, Sunny Isles Beach team, again, for allowing us to share this important and truly timely information to the community. So I also want to thank everyone who participated and gave us your questions in today's talk. So for those who are interested in more questions, please put them on the chat, and we will continue to answer them as the day goes throughout. And if you're also interested in learning about the All of Us research program at the University of Miami, we encourage you to visit joinallofus.org/Miami or call 305-243-8380. So with that, everyone stay healthy, and thank you, Dr. Carrasquillo, for enlightening us on vaccines, and thank you.
And again, thank you. Yeah, and again, thank you for sponsoring this. I think these are wonderful events. Obviously, thanks to Nick, thanks to Sylvia. I mean, you guys are absolutely wonderful. Keep up the great job you're doing, keeping our community informed. So thank you very much.
Thank you very much.
Thank you.
All right, take care.